In this chapter, we will discuss pharmacokinetics. Have you remembered pharmacokinetics include four processes: absorption, distribution, biotransformation, and excretion. Again, absorption, distribution, biotransformation, and excretion. Before we discuss these four processes, we should discuss how the drug passes through the membranes in advance. For the four processes all involved in the drug passing through the cell membranes. Mechanism of drug permeation. The drug could pass through the membranes by these four ways. A. They may diffuse passively through aqueous channel in intracellular junction. B. They could through typic cell membranes. C. They could be transported by carrier into or out of cell. D. They could through endocytosis or exocytosis. Very impermeable drug may also be bind to cell surface receptor, dark and inside. Cell surface receptor. Be engulfed by the cell membranes. Be engulfed by cell membranes. We call it endocytosis, and then release inside the cell, or expelled by the membrane's distinctive viscera out of the cell into extracellular space. We call it exocytosis. Water-soluble drug enter into cell through aqueous channel. Most typical soluble drug enter into cell through typic cell membranes. Some drug enter into cell by carrier. Large molecule drug couldn't pass through the membranes. They enter into or out of cell by endocytosis or exocytosis. For example, protein. The most major two ways of drug pass through the membranes. 1. Through typic cell membranes. We call it passive transport. 2. By carrier. We call it active transport. We will discuss passive transport and active transport in detail.